Hey, I figured it was about time to throw up a video on an update on the ACA, or Obamacare, whatever you want to call it. Um, so the law is now pretty much fully in effect. I don't know. It like previous videos, I was like, it's either going to be game changer or it's going to be the status quo or it's going to be a disaster. Um, Unfortunately, I don't think it's a game changer. I think it's a status quo. It's not really a disaster, because it's helped a lot of people. People I actually know. One of my friends got healthcare through the exchange. She's going to be paying $53 a month, and it's pretty good care. It's a silver plan. It's got $1,000 out of pocket, no deductible, mind you, no deductible at all. Just 10% copay. So whatever the cost of the doctor bill, you pay 10%, and the rest of it's covered, up to $1,000 out of pocket. So that's a good plan. It's a very good plan. Um, Drug coverage on that plan was $50 for name brand and $10 for generic. In other words, you pay $10 for a generic drug or $50 for a name brand drug, and then the plan covers the rest. So that's actually a pretty good plan. Um, the thing is, the cost of the plan is well, it's a lot. The plan was like $342. The government's subsidizing the bulk of that plan for my friend. Um, but still, that's an astronomical amount of money a month for on top of other bills that you have to pay. It that's expensive. So that leads me to other friends who did not get the subsidy. They're complying with the law. They're buying the insurance, but their premiums are skyrocketed. One friend was paying $172 a month for a health insurance plan. Um, their new plan, which is basically a bronze plan, it costs them 300. What was it, $320 a month or something like that. So that's a pretty big, steep increase, and they don't qualify for any subsidy. So they have to pay that a month to have that plan. Um, that's expensive. So the law is basically a hit and miss. I That said, the law needs to stay just because it's better than what we had, but still, that's a steep cost for a monthly payment for health insurance. When you factor in, you got to pay your rent, you got to pay your other utilities, food, and all that. That's hefty. That said, another thing I was interested in is something that nobody seems to talk about, but the Affordable Care Act actually offers a new metric in which to look at a state's economy. So if you look at states that fully implemented the law, you could get an idea of how their economy is doing. So, for example, if more people are going on the Medicaid rolls, as opposed, assuming the state accepted the Medicaid expansion, then are going into the private insurance market, that's an indication that state's economy is not doing that well. Because that means there's just more poor people in that state, as opposed to people that would be qualifying for subsidies for the insurance or no subsidies at all, which implies that you're actually doing fairly well economically. Um, and that's something I find interesting that nobody seems to be talking about on any of the media outlets, from the online ones to the main network, news, corporate news. It's interesting that that's not talked about at all. It's probably why my state chose not to expand Medicaid, but decided to implement the market exchange portion of the law. Because if my state actually accepted the Medicaid expansion, then most of the state would be on Medicaid. Because my state's pretty poor. We're like the number one creator of minimum wage jobs in the nation. We're a pretty poor state. And honestly, I think that's why they didn't accept the Medicaid expansion, because it would just look, you know, even though nobody's talking about it, I mean, eventually somebody would notice that, oh, dang, look at this. Most of the state's health insurance coverage is from Medicaid, and that's because nobody makes enough money to qualify for the subsidies under the exchange because everybody's poor as snot. So that's something to keep an eye out for. Looking forward, and it'll tell you a lot about the economic health of a given state within the union. So yeah, something to look at. General thoughts on it. Like I said, the law kind of helped me, kind of hurt me. My employer-based insurance dropped from 80% coverage to 70% coverage, but my deductible went down from 600 to 300. So it actually makes my insurance viable. I will no longer have the problem of going to a doctor and having the doctor bill not covered at all, which has been my issue with health insurance. You go to a doctor and it's just not covered, period, because you don't meet your deductible, and nothing's covered until you hit your deductible. Well, under the ACA, preventative care, such as seeing a doctor, is now covered. So the actual doctor visit is covered as preventative health care. So it actually covers something now. So it is a lot better than it was. There's other aspects of the law that I find dubious, mostly because it screams out, why did we do this type of law and not a universal single payer policy? Because, for example, you now have more rights to challenge a health insurance denial. So the insurance company might deny your treatment for whatever and say it's not medically necessary, or for what have you. Well, now you have a mechanism to challenge them, and the argument is, well, almost all challenges are supported, and the insurance company is then forced to pay for that treatment. The thing is, well, why do we have a system where you have to challenge your insurance company to treat you for your medical care? Like, it's weird. And it's like, okay, great. Now you have a mechanism in which you can challenge the health insurance company, but then you have to go through all that rigmarole to do that, to get the treatment. Why not just have a system where you just get the treatment? Like, it's just weird to have that system. But anyhow, that's just another rant on that topic. So anyhow, to sum it up, the healthcare law, better than what we had, helping millions of people, hurting millions of people. So it unfortunately it's going to be kind of, over time, it's just kind of going to be one of those types of things. So it's not a game changer, and it's not a real disaster. That kind of sucks. Oh well.